Welcome in. Thank you for coming today. So this is a cranial nerve clinic. Have you ever been into one of these before? Wonderful. So I have all of your information pulled up here. And I'm just going to ask you a few questions before we get started. So my first question is, has any of your information changed? Okay. And then what about any of your prescriptions or anything has changed with getting on a new prescription? Okay. And how long have you been on that? Perfect. And then what about, have you possibly had any medical treatments, or have you been to the hospital within the past 30 days? Okay. My last question is there anything that you are concerned about that you would like for me to check while I am doing this cranial nerve exam on you? Right. Okay. Perfect. No problem, I can do that. So how long has that been bothering you for? Okay. Yeah. Right. Okay. And have you had issues with that in the past? Okay. No problem. I will check that out during this exam. I don't think it's anything that's serious. It could just be something very minor, but I will definitely make sure to look at it. So I'm just going to put this in the computer really quick, and then we can get started. Okay, perfect. So for this exam, since I will be touching you, I am going to put my gloves on just to keep any germs from getting on either of us. These can be very tricky to put on when you have nails, so just bear with me for a second. Keep telling the front office to give us some better gloves here that fit a little bit better. I do like when they're snug, but sometimes they're just a little too tight and they're very hard to get on. So gloves are on, and I think what we will start with is the vision first, because there are more tests with that than any of the rest of it. So I want to get out my light here, and this is somewhat of a bright light, so I will be shining it in and out of both of your eyes and then up and down. So just bear with me, it'll only take a few seconds, and I'm just going to come into this eye first and kind of make sure that your pupils are dilating correctly, and then I don't see any issues with dryness or tear duct dryness, anything along those lines. Okay. Perfect. Okay, so I am going to come up from the top over here and just bring it down. So I just want you to keep focusing on me. Good. Very good. Okay, and then I'm going to come from the bottom And do the same thing, so just keep focusing on me. If you want to look right at my nose, you can. You're doing a great job. Okay, now I'm going to do the same thing with the other side. Very good. Okay, and then from the bottom, keep looking at me. Very good. Okay. So each time I check something, I will be writing it down, just so I can remember and I don't forget putting anything on your sheet, since a cranial nerve exam is very important. But everything did look good with your dilation. I didn't see any issues with constricting or anything like that. And when you were focusing on me while I was bringing the light from each direction, you did a great job at keeping that focus. So I don't see anything there that I'm concerned about. Okay, so what we are going to do next is I'm going to be using my fingers, just the two, and I will be going from in, out, and then I will go the opposite direction, so diagonally, and then the other side. And what I want you to do is continue to focus on my nose, and I just want to see how everything looks. Good. So this time I'm going to go from here again, but I want you to tell me when my fingers disappear. Ready? Good. Keep focusing on me. Let me know when my fingers disappear. Good. Okay, I'm going to go diagonally now. Tell me when my fingers disappear. Very good. And then the same thing with the other side. Very good. Okay, so what we're going to do now is I'm going to start from the outside and bring my fingers in. So what I want you to do is I want you to continue to focus on me, and once you see my fingers hit your eyes, where you can see from both eyes, I want you to let me know, okay? So I'm going to start from the middle first. Ready? Very good. And then I will do diagonally for both sides. Very good. And then the other side. Very good. Okay. Was that hard? No? Okay, good. So now what we will do is I'm going to start from the middle, and I will bring them up, and you tell me when you can't see them anymore, and then we'll do the opposite just like we did before, okay? So I'm going to start from the middle. Tell me when you can't see my fingers anymore. Very good. And then one more time. Very good. And then I'm going to start from the outside. Very good. Switch. Same thing. Very good. Okay. That was good. I didn't see any issues there. Let me write that down. Have you ever had glasses or anything before? Okay, good. Okay, so what we are going to do next is I'm going to put both of my fingers up, and I want you to continue to stare at my nose, and I'm going to put one finger down, or the two fingers down on either side, and you tell me which hand I moved, okay? Are you ready? Okay. Very good. Very good. Right. Very good. Good. Perfect. One more. Very good. Okay. The only other thing that I did want to look at is when I shine the light into your eye, I want to see if you can follow it. So what I'm going to do is I'm going to bring it in and out on both sides, just like this. And I want you to follow it back and forth for me, okay? We're just going to do from side to side and then up and down, okay? Both eyes. Ready? Just follow the light. Does that hurt at all? Okay. And then up and down. Very good. I'm going to switch eyes. Same thing. Just follow the light. And then up and down. Beautiful. Yeah, everything looks good with your eyes. I don't see anything that I'm concerned about. Okay. So the next thing we are going to do is listening to different words or sounds in each ear. And then we will also be doing a test of just me looking in your ears, making sure there's no fullness or anything like that. So I will be shining that light back into your ear. So I'm just going to start on this side first. So I'm going to grab my flashlight here. And I'm just going to shine it into your ear. Make sure that I don't see anything that I should be concerned about, because sometimes the fullness in the ears can cause a lot of issues with not being able to focus, or like a sense of ringing in your ear almost. And then also it can cause your equilibrium to get off. So if you feel any dizziness, anything like that. So it's important to check just to make sure. Okay, that ear looks good. I'm going to move over here onto the other. Just checking this one as well. Making sure I don't see anything. Okay, yeah, everything looks fine. How often do you clean your ears? Okay. Yeah, I really didn't see much fullness in them at all, so that is a good sign. Okay, so what we're going to do next is I'm going to start with this ear, and I'm going to say a few words, and I want you to repeat them back to me, okay? Perfect. Nickel, nickel, nickel. Do you know what I said? Nickel. Very good. Okay, same one with this ear. Like. Okay, very good. Like, and then one more. Tickle, tickle, tickle. What about that one? Tickle. Very, very good. Okay, same thing with this ear. What about that one? Mini. Very good. Light, light, light. That one was light. Very good. Okay, one more on this side. Bumblebee, bumblebee, bumblebee. What about that one? Bumblebee. Very good. So you got all of those right on each side. Were any of those difficult for you to hear? No? Okay, good. So we will go ahead and start with the exam part where I'm touching you, since I already want to feel around on your ears and make sure you're having no pain in them or anything. So I will start with this ear first. I'm just going to come over here and kind of massage them. Does that hurt at all? No? Okay. Okay, I'm going to move to this other side. What about that side? Good? Okay. Okay. So everything checks out with your ears and your hearing. Now I will be just kind of feeling around on your face, and then I'm going to do a few things where I have you press your cheek against my hand and try to turn, and then up and down. So we'll do a few of those tests just to make sure everything is functioning properly up there, okay? So what I'm going to do first is just kind of feel around on your face. So is it okay that I touch you? Okay. So just kind of stay still. I'm just going to be kind of patting around, feeling the texture of your skin, making sure everything feels good. Very good. Up here. Very good. Does any of that hurt? No? Okay, great. I'm going to feel right here on your nose. Good. Down here on your chin. And then right under your neck or your jawline. Just patting it gently. And then right down here on your neck, okay? Just barely touching. Okay, perfect. Didn't feel anything, no concerns there. So what I am going to do now is I'm going to put one hand on this side. I just want you to try to push my hand away, okay? So go ahead. Just turn it. Good. One more time. Turn. Very good. And the same thing with this other side. Turn. Very good. And again. Turn. Very good. Okay, I'm going to put one of my hands right under your chin. So try to push down. Just like that. Do it again. Very good. And then I'm going to push up. So just like that. Ready? Lift up. Perfect. And again, up. Good. And I'm going to do the top of your head. So I'm just going to take one hand and gently, actually I'll take both. I'm just going to push down on your head, okay? Very good. Very good. And I want you to try to push your head up, okay? I'm going to keep my hands still. Go ahead. Push up. Very good. Go to center and do it again. Push up. Very good. Okay. So now what I'm going to do is just feel around on your head a little bit. Just feel on the scalp. Very gently. Just going to kind of make sure I'm not feeling any knots or anything. Alright. See on this side. And this side. I'm going to feel behind your head. Very good. Okay, now I'm just going to go down from your shoulders to the mid part of your arm, and then I will mess with your hands a little bit, okay? So I'm just going to start down here. Just kind of patting on the hands, on the arms, I'm sorry, and your shoulder. And then I'm going to do the same thing with the other arm. And your shoulder. Just patting very gently with enough pressure. And you can feel all that, right? Okay. Same in the other arm. You could feel all of it. Good. Do you feel any numbing sensations or anything like that? No? Okay. Alright, so what I want you to do now is just hold out your hands. I'm going to take one of your hands and just kind of feel around on it. Doing the same thing, just patting, feeling. Nothing weird there either. You can feel all of that. I'm going to press your fingertips. Feel those? Good. Okay, we're going to switch arms. Do your other hand. Just still patting gently. Squeezing the fingertips, you can feel those. Good. All right, perfect. So far, everything is looking really good. We just have 2 more tests to do. Since I will still be very close to your face during these next 2 tests, I am just going to keep my gloves on. So I have some different liquids that I want you to smell, and there are 3 different ones. So I have put them in different jars, so I just want you to tell me what you think that smell is, okay? So there will be a few that are sweet, and then a few that may be a savory smell, okay? So I'm just taking a little bit of it, and I'm going to put it right under your nose. Can you figure out what that smell is? Yeah? What is it? Very good. It's bacon. Like bacon is a very potent smell, so it's a good one to try with a smelling test. So let me get my other one really quick. And I put all of them in the same jars just to make sure that you can't see anything or can't tell the difference with them being in different jars. Okay, how about this one? Just take a big whiff or a few whiffs. Kind of waft it in your face. What do you think that one is? Tangerine. Very good. Yes, I love the smell of tangerine. I think it is such a great scent. So I'm glad you guessed that one. Okay, one more. Okay, this is the last one for the smelling. Okay, this one's a tricky one. Can you figure out what that one is? I know it's a hard one. Here, let me get a little bit more. See if that will help you be able to smell it. Okay. What do you think? That one's tricky, isn't it? How about we try a different one? Let's do that. Oh no, don't be concerned that you didn't get that one. Sometimes the smells just are hard to pinpoint, so we'll just do an easier one. No worries. Okay, smell that one. That one should be pretty easy. What do you think? Pickle. Yep. Very pickly smell, isn't it? You want to know what that other one was? You do? It was burning paper. I know, such a weird one. And I know normally that has a very particular smell, but sometimes people have trouble pinpointing what it is. So if you would have just said anything that was burning, I would have given it to you. Okay. So the last test we have is taste. So same thing, I have a different product here. There's 3 different ones, and I put them in these little clear bottles. And I'm just going to be spraying this on your tongue. There's going to be 3 of these as well. And I just want you to tell me what you think this tastes like, okay? What do you think that is? Lavender. Wow, very good. Okay, here's the next one. Now think more of a savory for this one. What do you think that one is? Very good. Yes, it is a grilled cheese. I know. I don't know how they come up with some of these, but they put them in these little jars for us and have them test them on you guys. So if you eat a lot of grilled cheese, I see why that one was so easy for you. Okay, one more. Okay. I'm gonna spray this on your tongue. What do you think? Close. Try again. Grapefruit. Very good. Okay. So the last thing I do want to do before you head out is I just want to listen to your heart and your lungs, make sure everything sounds good. Because I know you were saying you were having some trouble with your breathing, so we will check that out. It could easily be something as simple as the weather, or have you ever had asthma, anything like that? No? Okay. Well, let me just check it out. Make sure nothing is going on. So just breathe for me normally. Good, good. Keep breathing. Very good. Okay, again. Good. One more time. Very good. Okay, I'm going to do your back. Breathe in for me. Good. Again. Very good. Again. Very good. One more time. Very good. Okay, last thing I want you to do is just take a deep breath in for me and out. We're going to do 3 of those on the front and then 3 on the back. I want you to do that just so I make sure I don't hear anything in the lungs when you're taking your deep breath in, okay? Go ahead. Let it out. Very good. Again, in, out. Very good. One more time. In and out. Very good. Okay, we'll move to the back. In and out. Again, in and out. One more time. In and out. Okay, very good. So the last thing I want to do, sorry, these things are just not fitting on my ears correctly, but what I want to do is just listen to your heartbeat, okay? So I'm going to listen to it for about 30 seconds just to make sure the pattern sounds right, I don't hear any arrhythmia issues, and then we will be done, okay? So just go ahead, breathe normally for me, and I'm going to listen just for about 30 seconds, okay? Good. Good. Very good. Keep breathing. Good. Just a few more seconds. Okay, very good. Okay, so I did not hear anything in your lungs. Your heartbeat sounded very normal. And the only thing that I could think it could be with you just having issues breathing is something in the air is making it feel very heavy and having issues with breathing. So what I would recommend is you just doing as many like showers as you can that are a little bit hotter. Let the water run over your face, blow out your nose, kind of like let it hit your chest. And you can take some decongestants if you need to. Just anything to help break up whatever is making you have issues breathing. Also, what you could do too is you could look into more of a specialist who works with like asthma and stuff. Because sometimes you may have never had asthma, but you could be getting it later on in life. So it could be something with that. But I did not hear anything that I'm concerned about whatsoever, so it really could be something very simple. But if it doesn't get better, definitely go to a specialist to kind of get that looked at further, okay? Great. Well, everything looked wonderful. I think that you look very healthy and you are doing a great job taking care of yourself. So just keep doing what you're doing, and I will just put everything on the sheet for you so that you can take it home, look it over yourself if you want to, and to where your actual doctor can have everything, okay? Yeah, of course. I'm so happy that you came in. This is something that's very important for a lot of people to do, so just make sure that you make this a habit in your life. Do it every few years, and you'll be good to go, okay? Yeah. Well, have a wonderful rest of your day. All right, thank you. Bye.